If you're trying to learn more about Medicare and the benefits of Medicare, maybe you're disabled, maybe you're applying for Medicare, you're turning 65, for whatever reason you're trying to learn more when it comes to the first starting part or starting stage of Medicare, this is the perfect video for you. So if you're new to my channel, my name is Pascal. I've been a licensed insurance professional for over 8 years, and I basically help people with retirement strategies when it comes to insurance and protecting their assets and things of that sort. So if you want to learn more about that type of information and that information interests you, make sure you subscribe to the channel. But now I really want to focus on the benefits of Medicare and how it works, right? As some of you may already know, there's two parts to Medicare. There's Part A, when it comes to Medicare, is hospital insurance, and then there's Part B, medical insurance, when it comes to Medicare, right? So for Part A, right, for most people that qualify, they have 40 working credits. Let's say you've been working over 10 years in the US. Most of the time, you don't have to pay an additional premium or additional monthly cost for your Medicare, right? So for Part A, the way it works is you're covered for 60 days, right, for hospital insurance. So you have 60 days of coverage, but in order to get that 60 days of coverage, you have to reach a certain deductible first. And basically what that means when I say deductible is it means that before you receive any hospital insurance benefits, right? Before you receive any hospital insurance benefits, you have to pay a certain amount into the plan first, or the Part A first. So the deductible right now is about $1,600. For 2025, the number is $1,676, I believe. That's the exact amount. So after you reach that amount, that's when Medicare hospital will kick in. And the way the hospital insurance work is basically if you're in the hospital for a long period of time. This is not like for doctors and things like that, routine stuff. This is for if you get an accident, God forbid, and you're in the hospital for 10, 20, 30 days. This is the part that will be covering you. And Part A basically is going to cover you for a 60-day period. And then after that 60-day period, there's going to be co-payments that you would have to pay if you are in the hospital past 60 days. And right now it's around $400 per day from day 61 all the way to 90, right? And afterwards, that 90th day is going to double. It's going to double from about that 400 amount to 800. And after days 151, if you are in the hospital that long, God forbid, there's no more costs that Medicare would pay after that point, right? So basically, you have that deductible, you're covered for 60 days, and then there's co-payments per day that can obviously add up to a lot of money later on. So a lot of people don't like that. I know it's not too appealing to just have that Medicare Part A, but if you keep watching until the end, there are some benefits that you can qualify for that are gonna drastically reduce the costs that you're gonna have for medical and hospital insurance. So just make sure you watch until the end because there's lots of benefits to having Medicare. But that's how Part A works. So the way Part B works, that's your medical insurance. These are the things that you're going to be using more often. You're going to be using this to see doctors. You're going to be using this to see specialists. You're going to be using this for potentially like one-time surgeries, like if you need to get some sort of knee replacement or whatever it is. This is going to be a medical insurance. So a big surprise that comes for a lot of people is they don't realize that Medicare costs $185 a month. So for people that are making under $106,000 on an annual basis, they actually have to pay a $185 cost per month. There's only really one exception for that when you are applying for Medicare and you have Medicare. The only exception is if you qualify for Medicaid. And for that, you have to be extremely low income. So a lot of people, and most people don't qualify for it, right? So for most people, you're gonna be paying $185. If you're above that 106 mark, right? If you're above 106 in terms of income, you are going to have to pay a little bit more than the 185. And there's like a progressive tax on how much more you're gonna pay. And if you want to look more on that, you can actually look at Medicare charts that will detail that even further, right? So the way the medical insurance works is a much smaller deductible than the hospital insurance. So the hospital insurance deductible is about that $1,600 that you would have to pay. For the medical insurance deductible, it's $257 that you have to pay on an annual basis. So for hospital, it's a 60-day rolling period. For for medical, it's only for the year. So that's the only time you would pay that annual deductible. So past that annual deductible, Medicare is going to cover 80%. You're going to pay out of pocket 20%, right? So basically, if you just have original Medicare and you have a certain procedure like a surgery that can be really expensive, sometimes surgeries go from 100 to 50,000 to 200,000 and beyond. So a lot of times that does concern people, right? So if you have for example, $100,000 surgery, Medicare is going to cover 80% of that. You would have to pay out of pocket 20%. And it almost leaves an uncapped risk potential for you, right? Because there's no cap to how much that percentage could be, right? So whether you're seeing a doctor or whatever it is, you're at the mercy of whatever they charge when it comes to just having original Medicare. And that's kind of like the conflict a lot of people come up with is like, hey, like I've been paying for this Medicare tax essentially my whole life. Why do I still have co-insurance and things like that I have to pay, right? The good news is there are plans that you qualify for that can give you some massive discounts, right? And I'll kind of go into that. So there's two specific plans that most people are going to end up going once they qualify for original Medicare. It's going to be either the Medicare Advantage or the Medicare Supplement, right? People are going to go one of these two routes, right? Typically not both. The way Medicare Advantage works, otherwise known as Part C, is rather than paying like a deductible, co-insurance, and all these other things that you don't really want to pay, right? You're paying flat co-payments for the most part, right? So these plans are typically zero premium plans. It's going to vary depending on the state you're in, the zip code you're in, and things of that sort. So you want to make sure that your plans are good based on your zip code in your area. But these plans typically don't cost anything on a monthly basis. They are zero premium plans. But Medicare does still cost $185 per month. There's ways to lower that cost, and I'll kind of go into that too as well. But for the most part, it's going to cost $185 a month, right? So with these plans, there's also rarely a medical deductible with the good ones, depending on the area you're in, right? So if a medical deductible is basically saying, if you need a certain procedure done, if you need to see a specialist, you need to see a doctor, you need to pay a certain amount first before you get the discounted benefits as stated in said plan, right? So rather than having that medical deductible, which you would normally have on the Medicare or whatever it is, a lot of times with Medicare Advantage plans, they don't have a medical deductible, meaning there's no waiting period that you have to wait, 10, 30 days. And it's also, there's no amount that you have to pay into the plan first in order to get those discounted benefits. So if it says for a certain procedure, let's say, or you're seeing a doctor, for example, if it says $0 to see a primary care doctor that's in network, it doesn't cost anything to see a primary care doctor in network, right? If it says $20 or $40 to see a specialist, it's gonna cost $20 or $40 to see that specialist. If it costs $300 for a surgery or $400 for a surgery, that's how much it's going to cost for that surgery procedure. So basically, you get the discounted amounts right away with Medicare Advantage plans, as long as they're in-network doctors. Sometimes with some plans, if there are PPOs, you can see out-of-network doctors at a higher cost. But if they're in-network doctors, a lot of times there's no medical deductible that has to be reached. And so this is a lot more affordable, paying like a $300 or $400 copayment for a surgery than just having plain old Medicare, where they charge you a percentage or whatever the procedure is. So a lot of times, Medicare Advantage is a very good option for a lot of people. Not good for everyone, but depending on your situation, it could make a lot of sense. And also, if you're admitted to the hospital, let's say you get an accident, you're in the hospital for 20 days, you might have to pay $300 for the stay, or like $300 for the first 4 days, depending on what type of plan that you have, right? So rather than paying a deductible, so say for example, you have that deductible of $1,600 about when it comes to Medicare Part A, you're paying for the stay of the hospital. You're there for 20 days, you pay a $300 copayment. That's what you would pay for the hospital stay until you get out of the hospital. And now, the good thing with Medicare Advantage plans is a lot of them, they have max out-of-pockets. So with these max out-of-pockets, This basically means this is the most you'll pay in a given year for your medical or hospital insurance costs. After you reach that max out of pocket, there is no more in-network costs for your medical or hospital insurance. Whether it's a surgery, you're in the hospital, you have a procedure need to be done, anything that would be covered by a plan is basically covered completely in full. So these max out of pockets for most plans are going to range somewhere between $4,000 to $10,000 depending on the type of plan that you have, right? But the good news is it caps the amount of risk that you have if something drastic, like you have cancer or some sort of terminal illness or whatever it is, and make sure you don't pay a ridiculous amount for some of these procedures that you might need to be done because it caps that risk. These Medicare Advantage plans work almost like an a la carte plan because a lot of these plans, they come with medical hospital insurance coverage, they come with prescription drug coverage, right? So one thing I will say when it comes to the prescription drug coverage of Medicare Advantage plans, you want to look to see whichever plan you're applying for covers every single one of your prescriptions. And it also comes with dental, vision, and hearing a lot of times. Not all plans, but some of them have those built in. So it's a lot cheaper of an alternative than the other one I'm going to mention to you because it has all these things built in. Now, there's still co-payments, right? And the biggest way I would probably differentiate a Medicare Advantage from a Medicare Supplement, which I'm going to get into, is it costs less on a monthly basis, but more if you get sick because there's these max out of pockets and co-payments you have to pay, considering you get some sort of serious illness like cancer or whatnot. Now, the other side, it's the highest quality Medicare plan that you could get, but it's also the most expensive, at least on a hospital insurance and a medical insurance basis. This is gonna be the highest quality. So basically the way this works, it's pretty simple, right? And I'm gonna be focusing on Plan G for the most part, right? There are other plans, but I wanna focus on this one because this one covers the most ground when it comes to your healthcare, right? So for Medicare Plan G, also known as the Medicare Supplement, basically it covers all the gaps when it comes to Medicare, right? So let's first start with the hospital insurance. So the hospital insurance that you normally have to pay, right, for the first 60 days, it's 100% covered with the Medicare Supplement. So there's no deductible or waiting period that you'd have to do with a Medicare Supplement. It'll just cover that first 60 days. So if you're in the hospital for 30 days, you don't have to pay anything, right? I had a situation where a client got injured and he had to actually go in another state and get care there, and they still covered him 100% for his hospital emergency. So even if you're going in another state, whether it's Michigan, California, Arizona, it doesn't really matter. You're covered everywhere in the US with Medicare, right? So it's very quality hospital insurance care, right? It's very hard to beat that type of hospital insurance because you're covered basically everywhere in the state or the country, right? That's how it works on the hospital insurance side. And now for the medical insurance side, right? Medicare covers 80%, right? You would have to pay out of pocket 20%. But with the Medicare Supplement, it covers that whole 20%, right? Meaning you don't have to pay anything in terms of a co-insurance amount with the Medicare Supplement plan, right? The problem with these plans is, even though they're high quality and they cover a lot of the gaps for Medicare, is a lot of times it's very expensive for people. You might have to pay an additional $150 to $160 a month for a Medicare Supplement, along with paying the $185 a month for the Medicare cost that you normally have to pay. Not to mention, it also doesn't come with dental coverage and also doesn't come with prescription drug coverage. So now, this is not me saying that it's not a good plan or anything like that. Everyone's situation is different, especially if you have a terminal illness, you have cancer or some sort of condition. When you're turning 65, you have a guaranteed enrollment period where you can get a Medicare Supplement and you can't get declined. Now, if you pass that window, the 3 months before or 3 months after, you kind of miss out, and the insurance company can decline you after that. But if you have some sort of condition like that, it makes a lot of sense to apply for something like a Medicare Supplement. Or if you could just afford the better health coverage, it might make sense to apply for the best medical and hospital insurance you can get. But another thing that I want to mention is, with Medicare Supplement, you have to apply and get an additional prescription drug plan, right? Because Medicare itself does not cover prescription drugs. You have to add that on in order to get your prescription drugs covered. And if you want to add dental, which is optional, you don't have to add that, that's going to cost an additional premium. So these bundles, in terms of what you could get for your Medicare with your prescription drug coverage, your Medicare coverage, your supplement plan that's going to cover the gaps, and if you add a dental, it could easily cost you $400 a month on a monthly basis to get all of your Medicare needs covered, right? So it could be pretty expensive. So it's really important to factor your Social Security income, your monthly budget, your retirement income, and everything, and you work with someone that's actually helping you make the best decision when it comes to your Medicare. Because if you can't, the only insurance that really matters is the insurance that stays. If for whatever reason you can't afford it or it doesn't work for you, it really doesn't matter, right? Because it's not gonna be there when you need it the most, right? So obviously everyone's situation is different. You have to make a decision based on the circumstances you are, because there's sometimes I talk with people, at this point I have a few hundred clients already. They'll say, hey, my friend has this, my friend has a certain insurance company. I think I want that insurance company too because it's been working for him well, right? But now, if that insurance company doesn't cover your prescriptions or it's missing something that you need for whether it's transportation or some additional benefits that are really important to you, it might not make sense to just go for an insurance company just because it's working for your friend. You need to count your circumstances, make sure your doctors are in network, or if you can afford the supplement plan, making sure it's within your budget, and all of your prescriptions are covered by the separate prescription drug plan that you have to apply for. Now, if you find this information valuable, make sure you subscribe to my channel. I'll put my number down below if you want to contact me and ask me questions in particular when it comes to Medicare insurance or any of the other types of lines of insurance that I talk about on my channel. But until then, I'll see you guys next time.